Welcome to this unit on regulatory considerations. By the end of this unit, you will be able to discuss regulatory considerations for AI for health. Does regulation stifle innovation? It is commonly asserted that stringent regulations will limit innovation and deprive healthcare systems, providers, and patients of beneficial innovations. But a balance must be struck between protecting the public and promoting growth and innovation. Use of AI for health is still new and often untested. Policymakers and regulators must consider numerous ethical, legal, and human rights issues. For example, regulators must identify AI applications that, through deceptive marketing, could persuade vulnerable individuals to follow health advice that may be contrary to their well-being. Applications that provide no therapeutic or health benefit might be introduced to collect health and biological data for use in commercial marketing, or to encourage patients to pay for irrelevant or unproven health interventions. For example, an academic obtained data from 300,000 Facebook users who were told that the data were for a psychological test. Their data and data from an estimated 50 million other users connected to them were then sold to Cambridge Analytica, which used them to build a software program to predict and influence choices at the ballot box. Such malicious use of data collected nominally for academic or health purposes could expose health systems, health providers, and companies that provide health-related AI services to significant risk. Regulation could ensure people are protected from disinformation and bad advice from health applications that exploit rather than assist. Regulation could differ according to risk, as outlined in the EU AI Act, such that those who are especially vulnerable, including people with mental illness, children, and the elderly, are adequately protected from harm. People living in resource-poor settings, in countries with inadequate resources to regulate and monitor adverse consequences of AI applications, and with diseases that result in marginalization and discrimination, such as HIV, AIDS, or tuberculosis, also require greater protection and oversight by regulatory agencies than users of applications for lifestyle or wellness. Transparency and explainability of AI-based devices. The black box nature of AI creates challenges for regulators. They may be unable to fully assess new AI technologies because the standard measures used to assess the safety and efficacy of medical technologies are not appropriate. Complex algorithms are difficult for regulators to understand and difficult for developers to explain. Improving the scientific understanding or explainability of an algorithm is necessary to ensure that regulators understand how a system arrives at a decision. Explainability is a requirement of the EU's GDPR and is being introduced into legislation in other countries experiencing proliferation of AI for healthcare. It has been argued that if a trade-off is to be made between transparency and accuracy, transparency should predominate. This requirement may, however, not be possible or even desirable in the medical context. Trust in decisions and expert recommendations depend on the ability of experts to explain why a certain AI system is the best option for achieving a clinical goal. Explanations should be based on reliable evidence of the superior accuracy and precision of an AI system over alternatives. The evidence should be generated by prospective testing of the system in randomized trials, and not their performance against existing datasets in a laboratory. Requiring every clinical AI decision to be explainable could also limit the capacity of AI developers to use AI technologies that outperform older systems but which are not explainable. Clinical trials provide assurance that unanticipated hazards and consequences of AI-based applications can be identified, addressed, and avoided entirely. Clinical trials, especially those carried out with diverse populations, can also indicate whether an AI technology is biased against certain subgroups, races, or ethnicities. However, clinical trials may not be appropriate because of their cost, the time required, the risk that the validity of results could be questioned if an algorithm is expected to change over time with new data, and because AI-based technologies are personalized to smaller populations, therefore more difficult to test with enough individuals. While AI should properly be validated in clinical trials or other applicable ways, AI itself could potentially allow more accurate trials of device or drug effectiveness with smaller patient populations through enhanced patient trial matching and data analytics efficiency. In place of clinical trials for AI technologies for health, regulators could introduce lighter pre-market scrutiny by assessing the safeguards put in place by developers, the quality of the data used, development techniques, validation procedures, robust post-market oversight. For example, the USA's Food and Drug Administration, or FDA, has applied this scrutiny to some AI-based services and products. Post-market oversight of novel algorithms may be difficult to implement and be too late to prevent harm to people who are especially vulnerable, such as those who have no access to a healthcare provider who could protect them from a misguided diagnosis. The transparency of the initial dataset and system architecture could be improved to allow others to validate an AI technology independently and increase the trust of users. While greater transparency of the components of an AI system can facilitate regulatory oversight, some transparency may misplace focus. Addressing bias. Regulatory agencies should create incentives to encourage developers to identify and avoid biases. And the criteria for quality set by regulatory agencies could include the risk of bias in training data. Regulatory oversight could be improved with robust post-marketing surveillance to identify biases in AI technologies, including in collaboration with providers and communities likely to be affected by biased algorithms or training data. Ethical considerations for LMIC and HIC with poor health outcomes. Low and middle-income countries often have insufficient regulatory capacity, so that they are unable to assess the safety and efficacy of new technologies. These regulatory agencies could consider either relying on regulatory approval of AI technologies in high-income countries or use of collaborative registration procedures to ensure that new technologies are appropriate for use. Global harmonization of regulatory standards would ensure that all countries benefit from rigorous testing, transparent communication of outcomes, and monitoring of a technology's performance. However, standards based on those designed criteria for high-income countries may not be appropriate for low- and middle-income countries. This is due to both the types of data used to train the algorithm and the assumptions used in developing an AI technology. For example, assumptions of what constitutes healthy may be defined by a small group of developers located in one company or country and validated by regulators in a high-income country with no considerations of whether the assumptions are appropriate for low- and middle-income countries. Regulators may also make assumptions about the context in which an AI technology was introduced. AI technologies may have contextual bias, whereby the algorithms may not recommend safe, appropriate, or cost-effective treatments for low-income or low-resource settings, or for countries that have resources but in which segments of the population still have poor health outcomes, as is often the case in some high-income countries. The developer of a technology for a high-income setting in which most of the population have good health outcomes may not anticipate or build an AI technology to anticipate differences from settings with poor health outcomes. A regulator, even if it requires prospective clinical trials, may not require data on how the technology operates in other settings. While the transparency of the data used to train algorithms, the context in which an algorithm is trained, and other material assumptions are necessary, they may only delay use of an AI technology, thereby avoiding harm, but not bestowing any benefit. Improving the performance and use of AI technologies in low and middle-income countries and certain high-income countries, and ensuring that the technologies are adapted to reality, will require different incentives, approaches, and developers of technologies that are appropriate for all people. You have now completed Unit 7 of Module 7, Elements of a Framework for Governance of AI for Health. In the next unit, we will look at policy, model legislation, and governance of AI.